necessarily reflect those of Rogers or Rogers TV.
Hi, welcome to Health Matters. I'm your host, Anita Mohan. We have a great show for you today. We're going to be focusing on fertility. And we have two fertility specialists in studio today. We have Dr. Gwen Goodrow. She's from Mississauga. And we have Dr. Robert Kiltz, who was flown in specially to do the show from New York. And back on the show is Dr. Steve Wexler, my co-host. So here we go. We're going to get right down to the point and ask the doctors here, what is a fertility specialist?
Doctor, you want to go ahead first?
A fertility specialist is, in Canada, is someone who's been trained initially in obstetrics and gynecology, and then most commonly gone on to do some further training at that point. Mm-hmm. In the United States?
Very similar. It used to be a 2-year program after an OBGYN residency. Now it's a 3-year program. Has both clinical and research. And then you have to pass exams in order to become a certified reproductive endocrinologist and fertility specialist.
Mm-hmm. Wow, great.
So who seeks out and when do people seek out fertility specialists? Because it's not the path that everyone has to take, but certain people, when do they realize that, well, something's not right, I need to see a specialist? Is it from their OBGYN or do people contact you directly?
People can contact us directly, but also go through their family doctor or their OBGYN. I think nowadays with people being so much more aware of the issue, and also with the power of the internet, I think the awareness that people have that there is help available and recognizing that maybe their problem is something that they've read on the internet and they realize that maybe they should go and seek help, I think drives people to contact their doctors and ask for a referral or even call a fertility center on their own.
So if couples are trying to get pregnant, when is the point when they should think, okay, we need help? Like if they're trying for years, or how many years would you say?
Exactly. There's probably different scenarios because it depends on the age of the female patient, or if there's been any past history of something such as maybe having a prior marriage and not being able to get pregnant in that situation either, or if they have some conditions such as pelvic pain that may be bringing that to their attention, or if they have irregular cycles, or most commonly, I think after trying for 12 months, if you're younger than the age of 35, and if you're old, 12 months, and then much sooner, the older you get past the age of 35, it's probably better to be more proactive for yourself as a couple.
Right.
And certainly if someone is feeling the emotional struggle that it's just not happening, it's usually time to talk to either their family doctor or OBGYN and certainly seek out a fertility specialist, because the waiting is hard.
Right.
Hard on the couples too.
Very hard on the couple, which adds to the stress of the process, which actually can make it harder and increase their infertility. Correct. Correct. So I believe that the moment they're beginning to even talk about that they're having an issue, they should seek some help. And certainly there's the time frame that's very, very important.
Yeah, and I agree. Anytime that they're starting to feel anxious, with the availability of care and knowledge out there, then they should go and seek it out, because physicians are there to provide them with information and education and assistance.
And you know, I think it's interesting that some women possibly who think they have a lot of problems actually are able to get pregnant, and some with no seemingly problems on the outside, regular periods, things like that, they have difficulty. Well, why is that? Why is it seem like you don't know who's able to get pregnant and who's not?
Because we don't know as much as people think we know, and it is actually very interesting, because studies have shown that many people that are fertile have many of the same abnormal tests as those that are infertile. So there is a large component that we don't understand. If you have no eggs, no sperm, so you don't ovulate or you don't have any sperm, or your tubes are blocked, we can tell you what the problem is. But there's a whole host of other difficulties, endometriosis, pelvic scar tissue, polycystic ovarian syndrome, that are factors that we don't understand why some women with those same problems conceive and other women don't.
Yeah, so people shouldn't put themselves behind the eight ball and saying, well, I have all these problems, I probably won't be able to become pregnant. And then people who are trying but say, well, I have no problems, we'll just keep trying. So, you know.
Exactly, and that's why it is definitely also an individual choice for the patient as to when they want to seek treatment. You know, for all the various points that Dr. Kiltz brought up, it may be better to seek treatment sooner. But you're right, even for a patient or a couple where everything seems normal, especially for the older woman, it may be better to go and have some investigations completed so they know where they're standing and what their chances are.
For all women, all couples who are thinking about having children, it's good to seek out some counseling advice on your diet and on your physical health prior to conceiving. Proper vitamins and proper diet, proper exercise are all very important. There may be some genetic abnormalities in the family that you want to get some counseling on. So you may be able to get a lot of these things answered and get some guidance and know if there's an issue even well before you're supposedly trying.
Now, for most of the people who seek care, are there simple problems, or do most people, or is it age that really complicates it? Like when people come in, is age the biggest factor at a certain point?
It can be at a certain point, definitely, because fertility declines as women age, particularly after the age of 35. So again, if someone has, say, irregular cycles, and then they're also getting older, that compounds the problem, and so then they, you know, should see a fertility specialist to get advice and counseling, and then also pay attention to things like weight and smoking and alcohol consumption and caffeine consumption, and make sure they're taking vitamins. And Dr. Kiltz, I'm sure, can add even more to that.
Stress reduction, which I believe is one of the major causes of infertility and most other health conditions, and working on that early on, I think, is very, very important.
Yeah, exactly. I would agree.
I think I had a couple that was a patient of mine, and they were actually, the main stress they had were that their friends were getting pregnant before them.
Exactly.
And every time I would see her, she would just say, well, so-and-so got pregnant and so-and-so got pregnant. So I found that added on to their stress even more.
Yeah, and if you can connect with a physician that you have confidence in, then they can help you realize that you're, first of all, not alone, that there are good support systems out there for you and how to access them. And then, you know, patients can look at supportive remedy or therapies such as maybe yoga or acupuncture or support groups or all of those things.
Yeah, it's an interesting point too, because, you know, everyone looks at, you know, we see these things on the news from other countries that, you know, if the woman can't get pregnant, there's all this social pressure from family, but it's no different in North America.
Yeah.
You know, we're just a little quieter about it maybe.
Well, it's definitely out there, but there's also a lot of social support. And when you seek out the social support, small groups, talking to a friend, the studies have shown that hormone levels shift and your fertility rates actually go up. So it's really important to open up and talk about it, although many people want to hide it because they're afraid and they think there's something wrong with them. You asked a question about how many people need this care, and actually many people who seek the care have simple problems, and a lot of it is just counseling and helping them understand their bodies and their chemistry a little bit, and simple things like ovulation induction or inseminations help many couples conceive without going to the more advanced things.
Yeah.
Do you want to go to the caller?
Yeah, we have a caller. We have Shashi from Brampton. Shashi, go ahead, ask your question, please.
Yeah, doctor. Actually, I had my first child when I was 28, and after he was born, after 1 year, when he turned 1 year, I was diagnosed with colon cancer. So I was given 6 cycles of chemotherapy, and I think 30 days of radiation. So, and they told me, I was in India, they told me you cannot conceive ever again. But since, science has progressed so much in all these years, since it has happened like 10, 12 years back, and my son, he still, wants another sibling, his brother or sister. So I just wanted to know, is there any probability I could get pregnant again? And after that treatment, my chemotherapy and radiation, I'm not ovulating anymore. And they always say they shrunk my ovaries due to the radiation. So could you please suggest me something? Do you think I can get pregnant again? And I'm 42 years old right now.
Okay.
Sorry, did you say you're
42?
She's 42, yep.
Yes.
In terms of assessing how the chemotherapy and radiation affected your ovaries, the fact that you're no longer having periods, therefore likely no longer ovulating, would suggest that it might be good for you to see a fertility specialist, because there are treatments out there, but they may not be quite the avenue that you thought you would go. Because if your ovaries have been affected by the prior experience of the radiation and chemotherapy, your eggs may no longer be viable. Doesn't mean you can't get pregnant, it just may mean that you may have to look at other sources such as donor eggs, which is a treatment that's readily available in the United States and also somewhat available in different circumstances in Canada. But again, you're a fertility specialist. Will be able to counsel you quite extensively on that.
Okay, could I go to my family doctor and he could prescribe me? I mean, he has to refer me to a fertility
That's probably the
specialist?
most efficient way of doing it, because then you can also involve your family doctor in your care and use your family doctor during your process as a support person. So that would probably be the easiest way.
Okay, thank you so
Yeah,
much.
thanks
you
for
have
calling,
given me the
Shashi.
hope.
Thank you so much. Thanks for calling. Does this happen often? People come in after certain cancer, radiation, things like that?
It's very common, and for women it's a little more challenging than for men. Men can preserve fertility by freezing sperm more readily. For women it hasn't been as readily available. It's coming more available, but it's not as successful as the as sperm banking is. But certainly there are some methods to help reduce the risk of certain types of treatments that may lower the risk of becoming sterile for a woman. In some cases, we use Lupron, a medicine that actually turns the ovaries off, that may protect them somewhat from different types of chemo and therapy. So it's something to think about.
So we're going to be back. We have Dr. Gwen Boudreau and Dr. Robert Kiltz, Sunita Mohan, and myself, Dr. Steve Wexler, here on Health Matters. We'll be right back, expecting your phone calls.
The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers or Rogers TV.
Hi, welcome back to Health Matters. I'm your host, Anita Mohan. We're talking about fertility this episode, and we have Dr. Robert Kiltz and Dr. Gwyn Quidro. Welcome to the show.
Thank
So
you.
we're going to continue what we were talking about before the break. And
That's an interesting word,
yeah.
fertility. You know, a lot of people talk about infertility as opposed to fertility. Is there a different way of speaking about it, or does it mean the same thing? Like fertility specialist, infertility specialist?
Well, I like to think that infertility is the negative word and fertility is the positive word. I'm a reproductive endocrinologist and an infertility specialist technically, but I like to consider myself a fertility specialist because we like to focus on the positive, and I believe that when people think they're fertile, they're more likely to be fertile. When they think they're infertile, well, that's going to follow too.
Exactly.
Right, and do people come in that state like, I'm infertile?
Yes, yeah. I think by the time they often come to see someone like myself, they've been trying for a very long time.
And what's a long time? Like, do people been trying for 5 years and then they finally show up?
Easily, yeah. Or they've been through various other treatments in different situations and have been told that they're never going to get pregnant, or that their case is hopeless or whatever. So our job
Especially if they were told by a doctor.
Yeah, exactly. But it all depends on who they saw, when they saw, what their circumstances were at the time, what was their health
technology
status.
has changed.
Absolutely, technology has really come a long way.
So let's stress that. This, you know, we've stressed that by 30, 35, things are starting percentage-wise down. So people are trying. So if you're close to that, you said 35-year-old, 6 months is about how long. So talk about that process. When I travel to India many times, and sometimes they have to actually counsel people on how many times to try a week, or when. Do you have a certain system that people go by?
Well, it's interesting because we see people that say they've been trying for a year or two, but you ask the question and they've been not using contraception and sexually active for 3, 5, or longer years. And that's really the most important question. So you start with that. How long have you been using unprotected intercourse? And that tells you something a little bit more. Is it more resistant or less resistance? And we're sitting down with the couple, preferably the couple, but most of it seems to focus on the woman in most of our practices, and finding a little bit about their menstrual regularity to know whether or not they may be ovulating. Certainly her age is one of those most important factors. The amount of years that they've been using unprotected intercourse, and then look at other factors such as surgeries or infections or other medical conditions like diabetes that may factor in as causes.
Talk about some of those conditions also that people, because if certain people have conditions, they should actually seek earlier, correct?
Yes.
So what would be some of those conditions?
If they have cysts or fibroids and things like that.
Exactly.
Is that an indication?
Polycystic ovarian syndrome?
A polycystic ovarian syndrome, that's most commonly expressed in a woman as irregular cycles without difficulty becoming pregnant. So someone who has cycles, and when we talk about a cycle, we talk about from the start of one period to the start of the next. That most commonly is every 26 to 32, 33 days. If people are outside of that window, it probably suggests that they need to seek treatment or information sooner, because the egg is not developing on a consistent basis. So therefore, even if with intercourse, it's going to take more attempts to try and get where you want to be.
Right. So even if people are in their 20s and they have these things going on, the earlier the better.
Absolutely.
Got it.
Wow.
So if your family doctor or someone advises you go off and try for a year, that's only good if you get periods every 30 days or thereabouts. If you don't get a period until every 3 months, you probably shouldn't wait. It's not going to be in your best interest.
Yeah, and some women with polycystic ovarian syndrome or irregular periods will get pregnant, but many of them do not. And so, ovulation in a 28-day cycle is usually about day 14. People can time intercourse, their urine test to tell about when they're ovulating. But you're not having that regular cycle, you don't know when it's happening. It's harder to time intercourse,
Right.
and so it's less likely to happen.
Probably a common, when people have intercourse, the sperm active for a certain number of days. People like.
We think the sperm viability is 48 to 72 hours, and the egg viability is maybe 12 to 24 hours around just after ovulation.
Wow, that's really narrow. See, I think a lot of people just don't know the physiology.
But in terms of the viability of sperm, there also is inherent variability within different men, right?
Sure.
There are some men that sperm probably lives longer, and also in terms of, say, timing intercourse, in regards to your question and your comment, is you'd like the sperm kind of waiting for the egg to come. So that's why when we say ovulation is most commonly in a 28-day cycle around day 14, it's good to have intercourse leading up to that.
And let's see, most people spend much of their youth trying not to get pregnant in their early reproductive years, and you're not supposed to know very much, or you don't have to know anything actually in order to create a pregnancy. But obviously when it's not happening, getting a little bit more information is helpful. But sometimes people stress a little bit over too many details, trying to get exactly when's the right time.
You see these movies, the timer goes off, the temperature's a certain thing. You have to come home from the office now.
That's right.
I think following your basal body temperatures and your cycles is actually adding to stress for many women and actually reduces success.
Like with diet and the scale.
Yes.
Similar. That's great. And then get back to the question, what other problems? So we have diabetes, we have polycystic ovaries, we have irregular periods.
Endometriosis, which I think is a very common condition, and from having no symptoms to infertility and pelvic pain, dysmenorrhea, which is pain with your menses. But endometriosis is a condition where the glands that are normally growing in the uterine cavity, which help aid in implantation and pregnancy development, can implant anywhere in the body, and most commonly around the fallopian tubes, around the ovaries, and that can cause inflammation, scar tissue, maybe even some immunologic autoimmune conditions that are also factors. So it's either some sort of immunologic factor, or it's an anatomic structural factor where it causes a structural damage to the tubes that prevent the egg and sperm from getting together. And sometimes the only way to know if someone has it is to do a surgical procedure called a laparoscopy and look inside. But often you can see it with pelvic ultrasound, but most commonly I think it's silent in many women with infertility.
And what about fitness and weight, nutrition? How does that factor in? Is there research now talking about that?
Yeah, because I heard that if you exercise too much, they were saying that some people are talking in groups that if people exercise too much, they have lower chance of getting pregnant.
That's right in certain circumstances. So if you take like an Olympic athlete, they often are exercising in their training so excessively, but that's because what they need to do because they're Olympic athletes, that they actually start to interfere with their own hormone production for the development of the egg. So that's one way. But otherwise, most people in North America are not Olympic athletes, so usually not that much of an issue, okay? And we all know that some exercise in a patient's life is a good idea for peace of mind and grounding of their body. And then in terms of weight, where you're talking about does weight affect fertility, and yes, we know that especially obesity definitely decreases fertility, but also increases risk of miscarriage.
And too thin, so too thin or too heavy are all factors in this. And obviously we know that there are many heavy women who conceive and have babies, and thin women also, but if you're infertile and you have those conditions, those are factors that gaining a little bit of weight or reducing weight actually can help with ovulation and help reduce miscarriages.
So let's talk a little about miscarriage. So if people have multiple miscarriages, is the infertility specialist the person to go to also?
And this is really important because most people in our training, multiple miscarriages is considered something different. But I like to consider it basically the same. If you're not having a child, delivering a baby live, that there's something going on that's related to infertility,
Yeah.
essentially. And many of the treatments are very similar
Yes.
anyway.
Absolutely.
Many of the causes of multiple miscarriages are likely genetic reasons, chromosomal, spontaneous reasons, usually related to a woman's age, but there are a host of other causes, the most commonly immunologic,
Yep.
maybe infectious, anatomic, structural abnormalities that go along with that.
And when is it multiple? Like when like if someone has one miscarriage, they don't necessarily go to the infertility specialist, or depending on their age. But back to that question.
The classic definition of multiple miscarriages is considered 3 or more miscarriages. Nowadays, probably people are a little bit more proactive in seeking out help or investigations after 2 miscarriages. And it's been shown that it's very reasonable to begin to do investigations and studies on someone who's had only 2 miscarriages and not wait for that 3rd one. And definitely what you said about adding age into that component. If you're 38 and had your 2nd miscarriage, you probably want to consider getting some investigations, because age will impact upon that also. And also nowadays, with people so tuned to their cycles and that, we're picking up what are called very early miscarriages, so biochemical pregnancies. We don't know exactly what to do with them, but I think everyone deserves attention and validation if they think they have a problem.
And for many women, that one miscarriage is a reason to seek some advice and maybe just some reassurance.
Absolutely.
Because it's very traumatic.
Absolutely.
Especially if it's your first.
Very traumatic, and there's significant evidence that seeking out some support is very helpful to overcome that and get you to move on to the next step.
There are good studies that have come out of mainly out of England, which show that if you have multiple miscarriages and your physician has done all the investigations and have not found any explanation, doing what's called the TLC approach, or tender loving care approach, in early pregnancy, basically from the point where they become pregnant, seeing your healthcare provider on a very close basis actually helps.
I mean, touching people and looking at them and talking to them
Seeing
and reassuring them is so important. Absolutely.
It is. 100%.
And the best doctor, best medical care is from the person who spends a little extra time and connects in a positive way. And I think that finding that healthcare provider that helps you through that shows more success.
That's great. So in our next segment, we're going to delve into that a little more, this mind-body approach, the TLC, like you talk about. You know, because we hear about, with chiropractors, it was a big thing that their wives wouldn't get pregnant if they worked in the office. And when they stopped working in the office, suddenly they get pregnant. It was like, it's stress that much involved. So, and especially if you guys have calls, if you're having problems with infertility or have some questions, please give us a call here, and we'll be back with Health Matters.
The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers or Rogers TV.
Hi, welcome back to Health Matters. I'm your host, Anita Mohan. We're back in studio talking about fertility. And we're going to be talking about this new book, The Fertile Secret, by Dr. Robert Kiltz. And we'd like to hear more about your exciting book.
Well, the idea of The Fertile Secret is a little bit of something stolen from Rhonda Byrne's the book, The Secret, which is the concept that our thoughts actually control everything in our lives, both conscious and subconscious. And so as stealing the idea basically is that we are fertile, and the fertile secret is that everyone is fertile and they can live their lives that way by beginning some practices that will help change their physical bodies as they change their mental approach to the process. And things like yoga, meditation, prayer, spirituality, nourishment, touch, massage, acupuncture, many other host of things that have been around for thousands of years have helped people through very difficult and challenging processes. And infertility is one of those things, and the fertile secret is everyone's fertile.
Right, and research is now backing it up more and more that, you know, that the stress hormones, I mean, if birth is a physiological hormonal event, I mean, if your cortisol levels are up, if you're stressed out, it changes things.
Well, just drive in traffic and feel your heart race, and someone cuts you off, and how you react to it, and how that affects your body. You sweat, you feel your heart beating, your stomach aches. And so it really is an important connection that we should, in modern medicine, be looking at more and more. Just like the TLC, it's the same concept that when someone feels reassured, they're calm, their stress hormones go down, oxytocin goes up, the good hormones go up, the bad go down, the reproductive organs function better, because in the fight or flight response, blood goes away from the core, and the core is reproduction.
Right, and if the tiger's chasing you, it's not a good time to have a baby.
Right on, right on. And so there are many concepts that are shared, and we should all be sharing on a regular basis.
And you were talking about support groups, so we were talking about before. I ran a cancer support group for many years, and they said, you know, doctors would be negligent not to tell their patients to do support groups because it doubled life in a lot of, especially in certain cancers. But you're saying in support groups with women, the same thing happens.
Absolutely, and the studies have shown that oxytocin goes up, that fertility goes up, whether it's becoming pregnant on your own naturally or with some assisted fertility treatments, it's improved success. I also believe it helps people when they're more positive to be more persistent. And getting anything you desire in life requires persistence.
Exactly.
And hope.
Absolutely.
As we talked about, when you have only positive energy, you feel better, and you're apt to pursue that dream that you have.
Now, is this something that's taught in your training, or is it something that has come into fertility?
You know, I think two things now. I think in medical school, this whole holistic approach is becoming more known, and whether or not there are active classes where they teach that, you can't teach someone how to touch and be kind in that, but you can raise people's awareness and also raise people's awareness on how beneficial it is. And in terms of stress, for each patient, what is stress for one person is not stress for another, et cetera, et cetera. So patients have to be careful that despite us being able to measure hormones and say this is in response to stress, you can't measure a hormone and say you are definitely stressed and therefore you're not going to get pregnant. We don't have a test to do that yet.
Right.
So the better test is, how do you feel as a patient, and how can we help you to stay grounded and at peace and find and maintain that hope and positive energy.
Yeah, you'll see couples where they'll get pregnant if they go away on vacation.
Yeah, exactly. There you
Now,
go.
is that a myth, or is that actually happening?
There
or people who get pregnant after they've adopted?
There are actually studies that have shown when people stop doing IVF and go and rest and put things aside, they actually can get pregnant on their own, and we've probably seen countless examples of that.
Worry, fear
Yeah.
is I'm worried it's not going to happen.
Yeah.
I'm thinking about it.
Yeah.
It bathes the body with all that stuff. But when you let go, when you are reassured, when you feel better, it's like, okay, I'm done. It often just happens.
Yeah, it's almost like you're making it happen by saying that I'm not going to get pregnant, or I'm having difficulty getting pregnant. So that's what you're telling your body, basically.
And we can't.
So the body has difficulty getting pregnant.
Yeah. So we can't say, yeah, absolutely, you're not going to get pregnant because you're under stress this month. But we know that positivity and good karma in the body can only be beneficial.
And the challenge is, okay, just relax, it'll happen, is easy to say,
Yeah.
but it's
Right.
hard to practice.
Yeah.
So really, it is helping share some of the concepts and ideas that help reduce stress, or it just helps increase your chances. What's interesting in America, maybe Canada too, that if I can give you a pill, a shot, or surgery, you're more apt to do that than you are to go meditate or go do yoga
Right.
or take a nutrition class to improve your nutrition. And so people want the simple, quick approach,
Right.
but they need to begin to look at other avenues. I always ask my clients what they do,
Yeah,
for what's their
absolutely.
job,
Yeah.
what other factors that may be in their lives that may be increasing stress, and we talk about
Yeah.
that.
Now, do you talk about that in the book also?
We talk about that in the book. Mostly we talk about methods to help reduce stress in your life
Great.
and increase your fertility.
Let's talk about that then.
And it really was written not just for reproduction and fertility, but I think it's a good guide for life in general.
To have a fertile life.
To have a fertile life. When you have a fertile life, abundance. Because often when you let go of the thing that you desire so much, it comes.
Interesting. Very good. Good topic. And your book you can get on Amazon, you were saying?
Amazon.com is a great spot. You can either get a Kindle version or a paperback.
Very exciting. Very exciting. I've spent some time around Dr. Kiltz's clinic, and you've actually put that into your clinic. Is that becoming more popular now that people have acupuncture and massage, yoga, different things like that in Canada?
Definitely, more clinics are at least having associations with facilities close by, or if they have a larger facility, they may have that in-house, as we say. But definitely, a lot of that is driven by demand by the patients. Patients are much more aware that these therapies can help, especially to reduce stress, and everyone is so conscious of stress nowadays, which is good that they're conscious and good that they're being proactive to seek out different ways to help themselves. And your fertility specialist can also help you figure out, which one maybe is going to be more beneficial, depending on your circumstance, such as, like you say, your job, what's manageable into your day-to-day functioning, etc.
And having been to Dr. Goodrow's center at ISIS here in Mississauga, I can tell you walk into the facility and you feel a calmness. And then the people that connect with you make you feel reassured. And just that alone is the beginning of that process of, because going to the doctor is a very stressful, and I know whenever I go, it's like, okay, my heart's beating, but it a little too fast, and it's good that it's beating.
Right, but you feel like you're sick, that you're showing up to the doctor because you're
Absolutely,
sick.
Right.
because in general, people go to the doctor with a problem, and they're there to often find something, where they need to often be reassured that they are fertile, and they're on the right path, and there is hope for them.
So it's, and again, has this become popular, say, in the last 10 years, 20 years, 5 years?
It's hard to quantify it, but I think it's
Yeah.
becoming more and more popular. We've brought in a spa environment, and we have acupuncturists, massage therapists, yoga specialists at all of our centers within them. If they walk in, you feel like you're in that spa environment. I think that's really important. I think more and more centers are incorporating it. And as Dr. Goodrow said, more and more people are affiliating with people, because that's really the key. Bring other practitioners in that know how to help in those areas. Because I'm not a specialist in yoga and acupuncture and massage, but we have people that are. And there's also other therapies. There's rain therapy, there's Reiki, there's music therapy, and art therapy. And I talk to many of my patients. What do they do that helps them relax? Do they paint or draw?
Does ceramics.
Right. It's very helpful for my stress reduction, and I think these are things that can really help our clients too.
Very powerful. Now, we talked about the mind body, we talked about other things, but there are some more advanced technology that's happening for women now, say in the last 10 years or 15 years, as far as fertility. So we're getting back to the scientific kind of side of it. Because some women, you said you can do some simple things. What are the more technical things that have come out that are more useful?
Probably the biggest advancement in the past 5 years has been our ability to freeze eggs. So when Dr. Kiltz was talking about what we call fertility preservation for patients who are entering into chemotherapy or cancer treatment or whatever, it is now possible in often a very short period of time to see a fertility specialist and preserve some eggs before you go through that treatment, before your ovaries are maybe removed or before your ovaries are damaged by treatments, etc. So that is now possible, which we couldn't do that very well up until a few years ago.
Wow, just a few years ago. Wow.
We could always freeze eggs, but we could never thaw them very well. But now we've changed the technology and how we freeze them, so now we're very good at thawing them, which makes a huge difference to their viability.
Excellent.
Yeah, you want to share?
Well, no, I think that's really the biggest technology over the last several years, but also I think we're improving our ability to identify chromosomal abnormalities with embryos, PGD, pre-implantation genetic diagnosis or screening. These are tests where we actually can biopsy an embryo. Before we used a technique where we only could identify a few genetic abnormalities. Now we're able to identify the entire chromosomal spectrum, and more genetic abnormalities are being identified. I think the test is beginning to become more widespread, so when we do in vitro fertilization, we're going to be able to identify those more viable embryos, so we can minimize the number of embryos to transfer, 1 or 2, and maximize the success at the same time.
So we'll be right back. This is our last segment, so get your questions in for Dr. Goodrow and Dr. Kiltz, questions for us, and we'll be right back here with Health Matters, maybe talking about what IVF is, because we mentioned that right before.
The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers or Rogers TV.
Welcome back to Health Matters. I'm your host, Sunita Mohan. Our special today is fertility. We have Dr. Gwen Goodrow and we have Dr. Robert Kiltz in studio and Dr. Steve Wexler. So this is our last segment. We're going to continue talking about mind-body connection and nutrition. And so tell us a little bit about nutrition. How does nutrition aid in ability to get pregnant, or should people really focus on nutrition at all?
I think absolutely we should all focus on nutrition and a healthy diet, and I'm going to tell you that I'm not sure I know what the right healthy diet is, because it differs for so many people and cultures and physical bodies, but certainly making sure that you're getting the right amount of protein, vitamins. It's recommended to use prenatal vitamins with folic acid to reduce neural tube defects and other abnormalities. So I think that's important to connect with someone early on. I think there really is very few people that are really nutrition deficits in these countries, so it's less and less of a problem. But I think
deficient in something.
That absolutely, or for some people that may have gluten allergies and moving towards a gluten-free diet, or women with polycystic ovarian syndrome and obesity and diabetes, they may benefit from a low carbohydrate diet. So these are things that I think are really important to talk to a nutritionist about and get some information. Supplements and herbs are used more and more, and there may be something that, and vitamin D deficiency is very common, and so many more women.
And they're relating that to infertility.
It actually affects fertility, and it actually can affect the quality of your eggs and embryos and success rates. So it should be something to look at early on.
Yeah, because patients usually ask me that, you know, they want to get pregnant, and should they detox? How should they get their body ready? Does it take a year? Does it take 6 months? Like, how long should they focus on themselves when they want to get pregnant?
Well, it's interesting. I studied with a fertility specialist in India, and we took 6 months, first child, 6 months before, and just worked on our nutrition and our fitness and our health. And not saying that did the trick, but you just being pregnant is, for a lot of women, they get very tired, and sometimes there's nausea and stuff like that. And being a pregnancy, it's great to go in with a full tank, and I think that's really important.
It's certainly very stressful on the body, and you see the changes that women go through after pregnancy. And detox diets can be very helpful for many people, because the body, again, if it's pre-stressed and now you add the pregnancy stress, it's going to have even more difficulties. Or if you already have some subfertility and you have you can benefit from detoxification diets. I'm not an expert at any of these. I highly recommend seeing a nutritionist or someone that really focuses on that.
Yeah, and even other than detox, just to eat well, because some people are so far away from eating well that eating well would be a detox diet.
I think it's like what we've been saying, is that looking at the big picture for the patient, that it's much easier to eat healthy and think healthy and be healthy if you've got a grip on stress, you've got some exercise in your life, you understand that smoking is not good for fertility, too much alcohol consumption is not good, moderate caffeine consumption, like you say, having vitamins and eating sensibly. A lot of people don't necessarily know how to eat sensibly because we haven't been taught.
That's why they have to watch our show.
Yeah, exactly, exactly. And so seeing a nutritionist as part of that is definitely a good plan. There's not going to be any magic diet, like Dr. Kiltz said, that's going to make or break your ability to get pregnant, but if it helps you to put your whole focus in living healthy and being relaxed and calm and focused, it will only help.
Yeah, because there's some people that have stressful jobs that will start their morning with cigarette and coffee and continue their day drinking coffee all day long, and then at the end maybe have a meal. So, that's a person where I would think, okay, there might be some difficulty there.
You know, and I think as you were saying with that fight or flight, if the body feels in peril all the time, there's no reason to have a baby. The body thinks, oh, well, I can't take care of myself. How am I going to take care of something else? But still amazing. People drink, people smoke, people take drugs, and they still get pregnant. It's amazing. I think that's the beauty of life.
And
I think we really don't fully.
And Dr. Kiltz saying very back at the beginning was that yes, people do get pregnant in all of the situations, but you're having difficulty getting pregnant.
Right, makes it much more.
Kind of puts you in a different category.
Yeah, I just want to change gears a little bit from the last segment. I think a lot of people relate fertility and IVF treatments, but as we talked about today, we talked about, I think, a lot of things other than that. So can you just explain IVF?
So in vitro fertilization, or IVF, test tube baby basically, where we're able to remove the egg from the ovary and take the sperm and add it to the egg, either in a drop or injecting a single sperm into an egg to help create an embryo. The embryo then develops in a culture condition in a laboratory in an incubator for a few days, and then 1 or 2, 3 at the most embryos are transferred into the woman's uterus at the right time.
But they're well checked, as you were saying.
They're checked, they're identified that they're growing, they look like they're growing normally, and then they're shared with the couple or the individual that we show pictures, and then using a tiny catheter with ultrasound guidance, the catheter goes through the cervix and into the uterus. And now we place the embryo there, but now the embryo has to implant, and it has to grow. So we collect lots of eggs, and many sperm are added to, less are fertilized, less grow to the stage where they're transferred, and then even fewer actually implant to become babies. And that's probably the black box of all this.
Sure.
But most couples who seek care for fertility do not need in vitro fertilization. Most can be treated with simpler treatments.
Right. And for our viewers, men who are watching this show, what should they know about infertility? Like, what should they be aware of?
We're focusing a lot. I think people think we're only talking about women, but so much we talked about. Nutrition and all that has to do for
it all. It all applies to all of the same things apply to men in terms of living healthy. There is much more biologic flexibility in terms of what can a sperm tolerate in terms of if they are smoking or overweight or have diabetes. It doesn't have the same level of effect on the viability of the sperm as it does on the egg. But you never know until you check the sperm. So one of the starting tests for a gentleman would be to provide a sperm or a semen sample and have it analyzed at a fertility center. And then you can see whether or not there's good numbers and good swimmers, etc.
Good swimmers, I like that. and are there treatments for men as far as that, if they have low motility or count or things like that?
Well, and all the same treatments between acupuncture and herbs and diet and stress reduction, very important. Some men have something called a varicocele, which are dilated veins that that drain the testicles and may affect the temperature, and in some cases can cause infertility. And studies have shown that repairing that can help. And then other conditions where men may be taking medications that affect fertility can be shifted to other medications that may be less of a drain on their fertility.
And isn't it a problem worldwide that there's less, I know in certain parts of Europe and stuff like that, sperm counts have gone down, possibly environmental stresses or just the stress of living? I don't know if I'm even saying something that makes
yeah, all those things are possibly true. I always say, you know, we haven't been counting sperm for that long in the scheme of life, so I don't think it's that important of a number personally.
Yeah,
and
no,
then
I agree.
and also like eggs, sperm can be taken out of a male, and also with certain things like cancer and things like that.
Exactly. Again, so if a gentleman is looking at having treatment for often testicular cancer or radiation or chemotherapy for other types of cancer, they may want to consider freezing some samples before they undergo this treatment, because you don't know what things are going to be like when you finish the treatment. Some treatments are not that harmful and the sperm will bounce back afterwards, but some will not, and some you just don't know. And it's relatively technically easy, and not very expensive for a couple to consider freezing sperm, or even a single gentleman, if he's not in a relationship but he wants to have children later in life with someone and he's about to go through this treatment, he still may want to consider freezing sperm.
And what about age in sperm? We talked a lot about women with age at 38, but they say, oh, men can have babies, you know.
Various studies and various opinions on that. There are some studies that show that really fertility in men doesn't decline in a significant manner until they're after the age of 70. And probably our Prime Minister Pierre Trudeau was an example of that. But there's also some more recent data that suggests that maybe even after the age of 40 in men that there's some decline. But again, we start with so much flexibility in the man that those declines may not be so apparent in the long run. Would you agree?
I agree.
And there's not as much of a thawing problem.
Exactly. We've perfected the thawing in men much earlier.
and when you have millions of sperm and you lose even a quarter or half of them, you still have lots of sperm left. And that's why
It only takes one.
It only takes
That's
one.
right.
The egg is a lot more valuable than the sperm, but they're both equally important in creating a pregnancy.
Wow, that's
Okay,
great.
we're just down to the last couple of minutes. What would you like our viewers to know about before we end the show? Something that you want to share?
Quick wisdom.
Well,
Quick
I think
wisdom.
one of the most important things is to begin to believe and think that you are fertile and practice some daily things such as meditation and yoga and eating well and mostly thinking well and connecting well.
Yeah.
TLC.
TLC and knowing that there is help out there and persons that you can tap into for information. The internet is a wonderful thing, but it can also be dangerous because it can be full of misinformation, and it's sad if someone reads some information, believes it to be true, and follows a certain path of treatment that in fact is not correct for them at all because it was wrong. So that's where you should access the resources such as your fertility specialist or a clinic like that to get the right information.
Right, and Dr. Kiltz's book, The Fertile Secret Guide to Living a Fertile Life. So thank you both for being on. And what are we doing next week?
We're cooking. So we're going to have the whole show dedicated to cooking. So please join us because it's going to be exciting. And you can send in recipes if you'd like. So we're going to have a lot of fun.
Yeah, we're going to cook and we're going to put recipes up so you guys can cook it on your own. Thank you so much, everybody. Tonight is a great show, and
Thank you.
we'll see you next week on Health Matters.